Today is World AIDS Day.
It's observed every December 1st, and it's an opportunity for people to unite in the fight against HIV and to show support for those living with HIV or AIDS. Today, the Biden administration announced a plan to end the HIV/AIDS epidemic as a public health threat by the year 2030. The president's strategy includes requesting what his administration calls unprecedented investments. In his 2023 budget proposal, President Biden called for $850 million to reduce new HIV cases by increasing access to prevention and care programs and ensuring equitable access to support services. The budget also proposed the creation of a 10-year, $9.8 billion program to guarantee certain HIV/AIDS services at no cost for uninsured and underinsured individuals. It's important to note these are proposals at this point.
Here in Indiana in 2020, there were nearly 8 HIV cases diagnosed per 100,000 people. That's according to the CDC. That's lower than all of our neighboring states with the exception of Michigan. The CDC also says there are currently just under 14,000 people with HIV in Indiana. In Indianapolis, the Damien Center has been serving people with HIV since 1987.
Yeah, that agency provides free testing and prevention care for people at risk of contracting HIV. WRTV's Meredith Hackler introduces us to someone who has been living with the disease for over 2 decades and shares his experience.
Major medical advancements have made living with HIV and AIDS manageable, and places like the Damien Center help provide people with the care they need once they're diagnosed. But people who are living with HIV and AIDS say that the stigma surrounding it still exists. Jeffrey Tuttle was diagnosed with AIDS in 2001.
A lot of things changed with people and friends. With my boyfriend at the time, I had none of that.
Tuttle was in the hospital for 8 months after his diagnosis. Once he was healthier, he came to the Damien Center, where they provided him with help and resources that he needed, especially at a time where he felt abandoned by the people closest to him.
It saved my life. I walked in at 98 pounds. I didn't feel loved. I didn't feel cared for. I didn't feel worth. And if you don't feel worth, it affects your drive to continue forward through your obstacles with your health.
Now, Tuttle lives a normal life. Thanks to medication, he's now undetectable, meaning he can't transmit HIV or AIDS to anyone.
If you're newly diagnosed with HIV, you're going to be fine.
But with so many medical advancements, the Damien Center says young people oftentimes forget about how dangerous the virus can be.
When we got the medications that we have today, we were able to bring that death rate way down, and that's great in a lot of ways, but it can also be a double-edged sword where people don't really always think about the danger anymore.
Which is why people like Tuttle and the Damien Center want to remind people to know their status.
People think, oh my gosh, I can't afford to get tested. Oh my gosh, I can't afford to get into medical care. And they don't realize they can come here and get it all for free.
Working for you in Indianapolis, Meredith Hackler, WRTV.
Well, the Damien Center says one thing they are monitoring is new cases of HIV.
They say during the pandemic, fewer people were getting tested, and some people stopped taking medications like PrEP, which prevents the transmission of HIV. So far, they haven't seen a spike in new cases.